Dr. Coleman, and in this tutorial we're covering heart sounds. So let's get straight down to business. Heart sounds are usually presented in medical notes in an abbreviated form, and they're presented as S1, S2, and S1 again. The gap between S1 and S2 is known as systole, and this represents the period of time when the heart contracts. The space between S2 and S1 is known as diastole, and this represents the period of time when the heart relaxes. This diagram is really useful because it depicts one movement through the cardiac cycle and frames heart sounds temporally in relation to whether they occur during, before, or after heart contraction or relaxation. Let's take a closer look at the S1 and S2 heart sound. The S1 heart sound is usually described as sounding like the word lub, and the S2 heart sound, dub. Let's put the heart sounds in so you can appreciate this better. Let's now take a closer look at what causes the S1 and S2 heart sounds. The S1 heart sound occurs when the tricuspid and mitral valves close simultaneously. This is followed by ventricular contraction, otherwise known as systole, and this forces blood through the pulmonary and aortic valves. And the S2 heart sound occurs when the pulmonary and aortic valves close. A period of heart muscle relaxation then occurs, and this is known as diastole, after which the cardiac cycle starts all over again. Let's now add in the heart sounds with this animation. The four heart valves and their respective heart sounds can be auscultated in the following anatomical areas. Let's now move on to S3, otherwise known as the third heart sound. This heart sound occurs during early diastole, just after S2. The word Kentucky is often used to illustrate the timing of the third heart sound in relation to S1 and S2. Let's add in the heart sound so you can appreciate this better. To better understand how the S3 heart sound occurs, we have to add in some blood flow to our animation. The first heart sound is caused by the closure of the tricuspid and mitral valves, and the second heart sound is caused by the closure of the pulmonary and aortic valves. The S3 heart sound is produced by the rapid filling of the ventricles during diastole. This produces audible vibrations which are heard as the S3 heart sound. Let's now add the heart sounds to the animation. We're going to start in slow motion, but then we'll speed it up to real time. The S3 heart sound is a low-frequency sound heard best with the bell of the stethoscope at the apex of the heart. It is heard in early diastole and is often referred to as a ventricular gallop. It is caused by rapid ventricular filling, which distends the ventricle and tautens papillary muscles. The S3 heart sound is a physiological occurrence and can normally be heard in children and in young healthy adults below the age of 30. But the S3 heart sound can also be an abnormal finding and typically can be found in pathology such as cardiomyopathies, aortic and mitral regurgitation, and constrictive pericarditis. Let's now take a look at the fourth heart sound, otherwise known as S4. The S4 heart sound occurs just before S1 in late diastole. The word Tennessee is often used to help describe the rhythm produced by the added fourth heart sound. Let's add in the heart sound so you can better understand it. Let's now take a closer look at why the fourth heart sound occurs. Now, because the S4 heart sound occurs momentarily before S1, I have changed our graphical representation so that it now starts with diastole and ends with systole. Blood flows into the atria and ventricles during diastole, and the fourth heart sound occurs when atrial contraction forces blood into abnormal, non-compliant ventricles. This produces audible vibrations which are heard as the S4 heart sound. The S1 heart sound is produced by closure of the tricuspid and mitral valves, and the S2 heart sound is produced by the closure of the pulmonary and aortic valves. Let's add in the heart sounds now so that you can see this work. We'll start this one in slow motion and then speed it up to real time. The S4 heart sound is heard best at the cardiac apex with the bell of the stethoscope. It is heard in late diastole and is often described as an atrial gallop rhythm. It occurs due to blood being forced into non-compliant ventricles, which means this heart sound only occurs in conditions where the ventricles are particularly stiff and do not relax normally. The term diastolic dysfunction describes this phenomenon. So as a result, the fourth heart sound is never physiological. It can be heard abnormally in conditions such as hypertrophic cardiomyopathy and systemic hypertension. Now this brings us to the end of the tutorial. If you found this video helpful,
sounds have two phases, inspiration and expiration. These phases constitute the respiratory cycle and are crucial for describing lung sounds and their temporal characteristics. Normal breath sounds are commonly termed vesicular. They generate a gentle rustling noise resembling the phrase whoosh ah. It is important to understand that lung sounds are produced by variations in airflow. Laminar airflow is uniform in velocity and direction and produces no sound. Turbulent airflow, on the other hand, is chaotic in velocity and direction and produces audible vibrations which can be heard through the patient's chest wall with a stethoscope. In the case of vesicular breath sounds, air enters into the upper airway, progressing through the larynx and trachea. The inspiratory sounds arise primarily from the lobar and segmental bronchi, where turbulent airflow generates audible vibrations. Air progresses into the narrower bronchioles and then the minuscule sacs known as alveoli, which are responsible for gas exchange. Airflow within these structures is characterized as laminar and does not produce any sound. The expiratory breath sound is produced by turbulent airflow in the larger bronchi and trachea. In vesicular breath sounds, there is no gap between inspiration and expiration. The sound is continuous. During inspiration, air is rapidly pulled into the airways, creating high-pitched and loud sounds. Expiration, on the other hand, is passive with less forceful airflow, resulting in a lower-pitched, shorter, and quieter sound. Vesicular breath sounds can be heard on auscultation of the thorax. Remember that the right lung has 3 lobes, whereas the left lung only has 2 lobes. There are no precise anatomical landmarks for lung auscultation, but the commonly accepted locations in medical literature is outlined here. Place the stethoscope's diaphragm on each of these areas. Listen to a complete cycle of inhalation and exhalation, making symmetrical comparisons as you progress down the chest. During anterior thorax auscultation, you'll primarily hear sounds from the upper and middle lobes. On the posterior thoracic surface, auscultation captures minimal sounds from the upper lobes, and the sounds are predominantly produced by the lung's lower lobes. Once again, listen to a full cycle of inhalation and exhalation at each point and compare both sides. In summary, vesicular breath sounds encompass distinct characteristics. These sounds are described as soft, low-pitched, and rustling. There's no pause between inspiration and expiration, and the inspiratory sound is longer, louder, and higher pitched compared to expiration. Vesicular sounds are prevalent throughout peripheral chest auscultation. The inspiratory sound arises from turbulent flow in the lobar and segmental bronchi, whereas the expiratory sound originates from turbulent flow in the central airways. Let's move on now to look at bronchial breath sounds. Bronchial breath sounds bear resemblance to the breathing of Darth Vader in the Star Wars movies. They have a hollow, blowing character that can be likened to the phrase "Corpus." Bronchial breath sounds are produced via the exact same mechanism as vesicular sounds. The inspiratory phase is generated by turbulent airflow in the lobar and segmental bronchi, while the expiratory sounds originate from the larger central airways. But the outcome is a very different sound. Bronchial breath sounds have a loud, hollow, and harsh blowing character. There is a distinct pause between inspiration and expiration, and the expiratory phase is longer and higher pitched compared to inspiration. Under normal circumstances, bronchial breath sounds are heard when auscultating over the central airways. A similar sound can be heard when listening over the trachea in the neck, and they may be heard over the sternal edge at the second intercostal spaces. Posteriorly, bronchial breath sounds can be heard by auscultating over the vertebrae C7 to T3. Bronchial breath sounds should not be heard on peripheral auscultation. The reason for this is that under normal conditions, the presence of healthy lung tissue and the overlying chest wall function as a filter, effectively dampening out higher frequency, harsh bronchial sounds. As a result, what is commonly heard during peripheral chest auscultation is our familiar, soft, vesicular sounds. Bronchial breath sounds are heard centrally when auscultating over the airways because there is no significant overlying lung tissue to filter and soften the sounds. When bronchial breath sounds can be heard on peripheral auscultation, this is abnormal and suggests the presence of an underlying pathology that enhances the transmission of vibrations from the larger airway. Solid tissue and fluids transmit vibrations more effectively than air. For example, in consolidation seen in pneumonia, the inflammatory process increases the lung's density. The denser tissue transmits vibrations from the harsh bronchial sounds to the surface, manifesting bronchial breath sounds during auscultation of the peripheral, and the expiratory phase is longer and higher pitched compared to inspiration. Sounds have a loud fibrosis, lung abscess, and collapsed lung above a pleural effusion. In summary, bronchial breath sounds exhibit the following features. The sounds have a loud, hollow and blowing quality. There is a pause between inspiration and expiration, and the expiratory phase is longer and higher pitched compared to inspiration. The sounds can be heard normally when auscultating over the